Everyone, welcome back. This is the second lecture over therapy and treatment. If you haven't watched our first lecture, I would recommend that you go back and watch that first one before you watch this one. Our first lecture talked about psychotherapy, and we discussed these different types of psychotherapy, or what we sometimes call talk therapy. Today, we're going to look at biomedical treatment, and there are some different types of biomedical treatment. When we're discussing biomedical therapies, really what we're doing is we're talking about how we can change that brain chemistry to hopefully help alleviate symptoms from different mental health issues. Now, most commonly, when we're talking about alleviating symptoms, this is through the use of psychopharmacology, or in other words, the use of psychoactive drugs. And in a moment, we're going to go over a number of very popular psychoactive drugs that can be used to help with mental health issues. But sometimes biomedical therapy is beyond psychopharmacology and starts getting into actually changing the circuitry by changing the structure of the brain itself. And so we'll have a couple of slides that look at that as well. But let's go ahead and look at this chart, and there's a lot going on. I recommend that you pause when necessary. I can't make this any smaller here. Try to put it in a good spot. Um, Pause when necessary to get this information into your notes regarding some of these different types of psychoactive drugs. So we're going to just work our way across, and let's go ahead and start with antipsychotic medication. So, first of all, why would we use antipsychotic medication? Antipsychotic medication is primarily going to be used for schizophrenia, but could be used for any mental health issue that is including psychotic features. So, for example, sometimes a person could be diagnosed with bipolar disorder with psychotic features. So, when we have these psychotic features, so we think of the positive symptoms, things like hallucinations and delusions, antipsychotic medication tends to help alleviate some of these positive symptoms by blocking dopamine. We have found that having too much dopamine in the synapse can lead to hallucinations. So another way to think about antipsychotic medications would be to view them as dopamine antagonists. Remember, that is when the medication blocks the receptor so that dopamine can't get in. And I have listed there some popular examples of antipsychotic medication. Thorazine is a big one. Thorazine was one of the first antipsychotic medications on the market, and it completely changed the way that we began to treat individuals suffering from schizophrenia. So it's a really popular drug that the College Board likes to ask about. So I would maybe highlight or underline Thorazine. The next one that we have is anti-anxiety medications. Clearly, this would be used for someone dealing with anxiety disorders, such as generalized anxiety disorder or panic disorders. And the way that this works is by reducing the physical arousal associated with anxiety. So, if we think about what happens to our body when we're anxious, that heart starts to race, our pupils dilate, our palms begin to sweat. And think back way to the beginning of our course. We talked about the neurotransmitter GABA, right? Get a break adjustment, and how GABA helps slow the body back down. Well, many anti anxiety medications work by slowing down the nervous system activity in the body and the brain to help alleviate that worried thinking and physical agitation. Antidepressants come in lots of different forms, but perhaps one of the most common antidepressants is what we call a selective serotonin reuptake inhibitor, or an SSRI, selective serotonin reuptake inhibitor. One thing that we have found with some individuals suffering from depression is that they have relatively low levels of serotonin. Well, how can we boost those serotonin levels up? Well, we can inhibit the reuptake. So again, remember back when we were talking about neurotransmission, when you have remaining neurotransmitters existing in the synapse, those get sucked back up into the presynaptic neuron. Well, we can inhibit that process, the reuptake process, which would then hopefully boost serotonin levels and boost mood. A couple more for you here. Oh, jumping ahead. When we talk about bipolar disorder, we talk about the mood spectrum being this really wide spectrum, and the swings from major depression over here all the way over to states of mania. Well, we have a pretty good idea of how to alleviate the symptoms of major depression. So then we're kind of stuck with the high highs of mania, right? And it is found, it's believed that part of what causes these swings is an imbalance in the neurotransmitter glutamate. That if we have too much glutamate, it can lead to mania. If we don't have enough glutamate, it can lead to depression. And so we have these mood stabilizers, such as lithium, that can shrink that spectrum down so that the swings in emotion are not as drastic as we tend to see with bipolar disorder. And then finally, ADHD medication, we sometimes refer to as stimulants, which can sound odd at first, thinking, well, why would we give a stimulant to someone with ADHD? And we need to remind ourselves when we're talking about ADHD, right, attention deficit hyperactivity disorder, when we are looking at the attention deficit, then part of that theory is that a person needs constant stimulation because otherwise they are distracted. If they're trying to do their math homework, they're not getting the stimulation from the math homework that they need. And so they are easily distracted by their phone or the TV or whatever it may be. And so, stimulants such as Ritalin, what this does is it can help focus that attention. The way that it works is it blocks the reuptake of dopamine from from the synapse. And so, we need to be a little careful. If you see a question, for example, that's talking about dopamine, well, if you have a person with schizophrenia, we want to make sure that dopamine is not crossing through the synapse. So we block that dopamine through an antagonist, right? That would be antipsychotic medication. But with ADHD, we want to try to bump those dopamine levels up, right? We want to have a stimulant where we block the reuptake. When you block the reuptake of dopamine, dopamine levels increase. And so it would be unlikely you would see a question like this, but you can start to hypothesize and theorize, well, what would happen, for example, if you had someone with schizophrenia who took Ritalin? Well, if you had someone with schizophrenia who clearly already has an excess of dopamine in their brain, and then they're taking Ritalin, which is going to increase that dopamine, we would expect even more of those positive symptoms, which is why you have to use extreme caution anytime you're using these medications and make sure that you're following the prescription from the psychiatrist themselves. And then we're going to spend just a little bit of time here looking at brain stimulation. And there's two main types that we'll discuss briefly. We're going to talk about ECT and TMS, and these are two different types of brain stimulation. So let's look first at electroconvulsive shock therapy. It's not exactly what you see in the movies, right? If you've watched the movies or TV shows where they have ECT and it looks like this barbaric, horrific type of torture, the reality is it isn't, and we still use ECT today. What ECT does is electroconvulsive shock therapy is going to send a mild electric pulse through the hemispheres of your brain, which has been shown to alleviate some cases of severe depression in people. Now, we're not exactly sure how this works, but there are some theories as to how it works. One thing we've found is that it helps with neurogenesis or the creation of new neurons. Additionally, it's possible that we see this change in blood flow and the rewiring of neurons in the brain. And so it's this interesting look at how we can kind of snap that brain right into place. And that's probably, I don't know if I'd put that in your notes, snap the brain back in place, but it is allowing us to rewire some of these neural connections to alleviate symptoms of depression. And then TMS, transcranial magnetic stimulation, is a little different. This is going to include placing electrodes that are implanted in the brain and then stimulating those electrodes, which again causes the brain to be more active and causes these neurons to fire. It disrupts the depressive electrochemicals that are found in the brain and allows for perhaps this rewiring where people feel this elevation in mood and this decrease in some of the symptoms that we see in severe cases of depression. And then finally, our last slide here is about psychosurgery. Um, over centuries, we've gone through lots of interesting and relatively bizarre attempts to alleviate some mental health issues. Trepanation would be that top right picture there. Trepanation was this idea that if a person was suffering from mental health issues, if they were hearing a voice that wasn't there, then perhaps it was because there were demons in their mind. Well, how do we get demons out? We drill a hole in your head. Well, Trepanation would often work to get rid of the voices in their head, but it would also often kill the people. And so that didn't really work in the long run, right? So we don't use trepanation anymore. Lobotomies, sometimes used today, but incredibly rare. The idea behind the lobotomy is severing the connections in the frontal lobe. Originally, lobotomies were literally done by placing ice picks through the eye socket and then moving the ice pick around, which severs the connection between your frontal lobe and other parts of your brain. You don't need your frontal lobe to live, but you do need your frontal lobe to think critically about the world and understand cause and effect and consequences. And so when we destroy some of those connections, people can become more docile and maybe they aren't worrying about the future anymore because they have a hard time thinking about the future. And then finally, microsurgery or neurosurgery. This is still done today, and this would be when we are conducting surgery on the brain to help alleviate people from different ailments that they may experience. So we talked, for example, about split brain procedures, where if you have someone who's suffering from epilepsy, going in and severing the corpus callosum may help alleviate some of those problems. All right, lots today. I tripped over my words a handful of times. Hopefully, you got it all in your notes. If you have any questions, don't hesitate to reach out to me. And as always, good luck, everyone.